Hello, everyone. Welcome. I want to begin by acknowledging the traditional custodians of the land that we're meeting on today. And I want to pay my respects to elders past, present, and emerging. So welcome to today's session. You will have the opportunity to meet some of our faculty alumni, which is very exciting. You want to hear about their career journeys, study experiences, ask a few questions, please do. So for myself, I'm Danielle Amit. I am the Assistant Course Coordinator of the Bachelor of Psychology Honours here at Monash. I'm also an alumni of this course myself, so very fun to go through that process and then continue to be part of this program. I graduated myself in 2016. And today I'm delighted to introduce to you our wonderful panel of faculty alumni. So I have Alex Robinson from Psychology. I have Catherine Main from Health Sciences. I have Emily Nelson from Public Health and Hogan Sharp from Radiography and Medical Imaging. So if you have questions for our alumni, please do feel free to send them through to us via the chat. We will aim to answer the questions as much as we can within this fun time frame that we have. And so I invite our alumni to please introduce themselves, give us a bit of an overview, I guess, of your study experience and your career journey to date. So Alex, I'm going to throw over to you to start us off.
Oh, wonderful. Thanks for that. So I'm Alex and I did psychology. I actually did the same course that Danielle did, I think maybe just a couple of years behind you. But that was the Bachelor of Psychology, the one with honours in the brackets. So that's what I did. And what I do at the moment is I'm doing a PhD in clinical psychology. So I'm still studying, but what that involves is half the time I'm doing my kind of post-grad training to become a clinical psychologist. And that involves, doing placement, learning all the skills and getting really good supervision. And then the other half of my week is involved in doing research. So my topic of interest is methamphetamine addiction and decision-making in that. And I think, it's a pretty cool space to be in because you learn about interacting with human beings and helping them in the clinical side. And then when you're doing the research, the other half of the week, you're kind of learning how to develop that new kind of stream of treatments that hopefully you'll use again back over here. So it's a cool model and I quite enjoy it. And it definitely keeps you quite busy. In terms of like my undergrad experience, I came at things a little bit differently maybe than your typical year 12 person. So I finished year 12 and did a degree in journalism. And I decided, oh, that's probably not for me and I'm probably not for that. But I knew after that I still wanted to pursue a different career. I knew that I wanted to work with people. I knew that I wanted to help with people. And I knew that I really liked philosophy, like that was kind of my thing. And putting all that together seemed to scream out psychology. So that's what got me interested. And then why Monash, I guess. I had a lot of friends who, when I was doing my first undergrad, who were at Monash. They seemed to enjoy it. They seemed to get jobs, which seemed pretty cool. And then a couple of people had done the psychology course and they got into honours. And I thought, wow, if you got into honours, that seems like a good sign. So yeah, did the undergrad and really, really enjoyed it. I think maybe what made it stand out for me was just the interaction with some really just prestigious academics, but they always gave you your time and just always hung out with you. You could ask them questions. And then eventually that led me getting into a lab, working with my supervisor who I have now. And it was just like a really interactive experience that helped me grow. And I think also got me into honours, got me into the postgrad. So very much enjoyed it.
Nice. Thank you so much. Catherine.
Hello. Yes, I feel like what I've prepared was a little bit longer than that, so apologies in advance. But my name's Catherine. My pronouns are she, her, and I completed the Bachelor of Health Science here at Monash 3 years ago, so in 2017. I grew up in Warrnambool, which is a regional part of Victoria, and I never really had a super clear idea of what I wanted to do when I finished high school. I come from a long line of teachers in my family, so pretty much all I knew was that I did not want to become a teacher, but that was literally all I'd ruled out by that point. So when it came to enrolling in uni courses, I really just relied on trusting my gut and choosing options that matched with my interests. And at the time, For me, that was health promotion. I really loved studying health and human development in high school, and the health science course here at Monash, it seemed to really align with that. It's all about supporting people and communities to stay happy and healthy. And that was something that really excited me. So I decided to roll in the course, and I haven't looked back since. The thing I probably enjoyed most about the course was the flexibility and the variety that we had when it came to choosing what subjects we wanted to do. You get heaps of options when you're planning your course map. So you pretty much always get to learn subjects that interest you and that align with the career path or direction that you're leaning towards. Health science can seem like this really big, broad field, but the awesome thing about Monash is that they let you really narrow and tailor your focus to suit what you're into. And for me, that was health promotion and community development. A massive highlight for my course definitely would have to be the amazing teaching staff. Here at Monash, we're really fortunate to have the chance to learn from people who are absolute leaders in their field. I remember my tutors and lecturers would always share these crazy stories about their careers in health science, like some of them practically helped to eradicate diseases in developing countries and stuff. So it's really like awesome stuff to be learning from these role models. And it gave me a super clear idea of my career options and what I wanted to do. The absolute best decision that I made during my course that I would encourage any of you to do is applying to participate in placement units. I did this one called Health Promotion Practicum, where I got to do placement 1 day a week for my final semester. And my placement was with a not-for-profit organisation out in Dandenong. And my role was to support asylum seeker and refugee communities with their mental health. I learned so much and I absolutely loved it. And that experience is what kind of really cemented in my mind what I wanted to do for my career. And you'll get sick of hearing it, but establishing your career really is about the people you know and the networks you make. And it was because of my placement that I got a foot in the door for my first job in health promotion. My placement supervisor was the person who told me about the role. He gave me the world's best reference. And it's because of the knowledge and skills that I gained through this course, but especially through my placement, that I got the job, which also happens to be my current job. I've been there for close to 3 years now, still going strong. So my job's in local government, working for the City of Greater Dandenong Council in their youth and community development team. And basically what I do is plan and deliver a heap of projects to help address local youth issues and help young people to stay happy and healthy. I manage my team's health and wellbeing portfolio. So I get to address a wide variety of health issues through my work, ranging from things like mental health and family violence to physical activity, social inclusion. And that's the great thing about working for local government. They have such a broad sphere of influence that you're never stuck working in one specific area. Literally no month looks the same. At the moment, I'm conducting a research project to measure the impacts of coronavirus on young people and families in our community. So I'm busy running lots of consultation, facilitating interviews and focus groups, and then analysing the findings so that we can understand what the different emerging needs and issues are. Sorry, I need to sneeze. Where was it? I think that's why this degree has been really helpful to me. We learn all about research methods and how to collect accurate quality data. I had classes where we literally practiced how to write consultation questions and be a good facilitator. And now I'm applying those skills every day in my job. My favourite part about my job would probably have to be working with such an awesome bunch of young people. Coming out of my course, it never even occurred to me that I might become a youth worker, but it's a really hands-on way to apply everything that I've learnt. I get to work one-on-one with young people, supporting them to manage challenges in their life and promote their well-being. And then I also get to run group programs and deliver workshops and events for schools. It's super interactive, interpersonal, and it's not at all like the really clinical research-based jobs that you might think of when you hear the term health science. When it comes to my career goals, I wouldn't say that I have any super concrete plans. I've always been interested in international development, and I've been hoping to work in the community development field overseas somewhere, but coronavirus has thrown a bit of a spanner in the works there. So for now, I'm pretty happy with where I'm at, and I know I'm probably running over time. So I just want to say that if you're passionate about health and you love working with and learning about people, health science is a really awesome course. It creates such a wide range of career options, and no matter sort of what your skill set or interests are, you'll probably find a path in health science that you really love. So yeah.
No, I love that. Never apologize for your passion, Catherine. It's awesome to hear and it's inspiring. I'm going to throw it over to you, Emily.
Thanks so much, Danielle. Good morning, everyone. My name's Emily and I studied a Bachelor of Public Health Science at Monash, which I finished at the end of last year. So I chose to study this degree as I realised quite early on whilst I was at school that I was interested in health and the health system, but I also wasn't the biggest fan of blood and guts, so I knew the clinical type of courses weren't exactly for me. So after I did a bit of research, including attending open sessions such as these, I realised that studying something like public health was for me, because I could still study about disease, the health system, disease prevention, and as well as human development, but without the clinical side of things as well. What drew me to Monash in particular was the feel of the campuses during open days and info night. And I know a lot of you may obviously aren't able to experience that just yet, but hopefully you will soon enough. But that was a really big thing for me, and as well as the opportunity to undertake some study overseas, which is something I knew I really wanted to do. And I also knew I would have the opportunity to participate in a professional placement before I graduated as well. So those were another couple of factors that really appealed to me as well. Throughout my degree, some of my highlights were going on a 2-week public health study tour to Indonesia. So we did 1 week in a rural town called Yogyakarta over in Indonesia, and then we did 1 week in the capital, Jakarta. So it was really good to be able to contrast the health challenges between those rural versus urban setting. And it was also, gives us quite good perspective in comparing their challenges over here to what we face here in Australia. Another highlight for me was the health promotion practicum, which is similar to what Catherine just mentioned. So yeah, that was a really big highlight for me. So like Catherine, I was able to gain professional experience, build my professional skills, gain industry insights, as well as build my networks when I did my placement at Monash Health in my last semester last year. And it was a really rewarding placement as well. So after I finished my studies last year, I was able to get a role in the Australian Department of Social Services in their graduate development program, which I commenced in February this year. So the Department of Social Services, or DSS, is the primary department responsible for social policy in Australia. So we look after a lot of the social policy for families, disability groups, family and domestic violence, and a lot more as well. But those are some of the areas that we're responsible for. And the mission of the department is to improve the well-being of individuals and families in Australian communities. So we fund a lot of community organisations, and we deliver and develop a lot of policies that work to achieve this mission. So my first rotation in the program is what's called the Community Grants Hub. So I work with a lot of community organisations which the government funds, and I just make sure that they're spending the funds in accordance with their contract, and that they're delivering on the priorities that the government wants to meet, and also just help them answer any questions, etc. So when COVID-19 hit, though, it kind of threw a spanner in the works in terms of my grad program, but it actually turned into a really amazing opportunity. So obviously when the first round of restrictions hit, we saw the big queues outside Centrelink, and the government determined, you know, we need a lot of staff to go and help Centrelink deal with their surge in demand. So I had a really exciting opportunity to take a temporary secondment to Services Australia, which is the agency that Centrelink comes under. And I was able to go over and help out process the backlog of claims, which was a really, really good experience. And it was very rewarding, and I really valued being able to do my bit to help during the crisis. So I was there for a few months, and then I came back into my normal role, which I'm still in. But next week I actually begin my second rotation, which I'll actually be moving to Canberra for. So I'll be taking a more policy-focused role. So I'll be working within family, domestic and sexual violence policy, which is an area I'm really, really passionate about. So I'm really excited to start that role next week. My degree has certainly helped carry me through my roles this year. A lot of the concepts that I learned about in my public health degree, such as primary prevention, a bit of social policy, and how policy can influence behaviour change and improve health and wellbeing outcomes, are all very much relevant in my work. And I also have to do a lot of writing, a lot of reading, critical thinking, data analysis, and those are all things that the degree prepared me really well for, I think. In terms of career aspirations, for the moment, I'm really enjoying my time in the department. The mission is something that aligns very well with where I want to go in my career. And so I can see myself hopefully staying in this department for quite a few years. But I think down the track, I also have aspirations to work more directly in something, perhaps health policy directly. So perhaps in the state or federal departments of health. Just before I want to wrap up, I know a lot of you may be quite nervous entering tertiary studies during this time of crisis. But I honestly think if public health or health promotion, as a matter of fact as well, if those are areas that you're interested in, I think the timing is actually really good. With the pandemic now more than ever, we're going to need, you know, public health experts to conduct research, evaluate our responses to the pandemic down the years to come, and create future policies and plans to hopefully make sure that something like this doesn't happen again, or if it does, how can we minimize its impact? So yeah, as I said, I think if it is an area you're interested in, the timing is quite good for you, and I'm very optimistic about the job market and the future of public health. So good luck, and thank you for listening.
Thank you so much, Emily. Yeah, I think that's such a brilliant point. I'm so glad that you've raised, you know, the timeliness of some of these career pathways we might be considering and study opportunities. I'm going to throw it over to you, Hogan, please. Yeah, give us some insight. Introduce yourself.
Yeah, no worries at all. Geez, what an entourage to follow. But basically, I'm Hogan, guys, and I'm a radiographer at the Alfred Hospital in metropolitan Melbourne. I studied the Bachelor of Radiography and Medical Imaging at Monash University, and I graduated at the end of 2017. I've been a radiographer for 3 years, and I can agree with everyone else in the fact that COVID-19 has definitely thrown a spanner into the works of not only what they do, but certainly what I do as well, and everyone I work with. I think it's good to start with what is actually a radiographer. So a radiographer is a diagnostic and allied health diagnostic imaging professional. So separate to that radiologist, a lot of confusion exists in that separating a radiologist from a radiographer. So remembering that the radiographer is someone who takes the imaging, so maybe whether that be X-ray, CT, an MRI, or an ultrasound scan, and then we send that off to a doctor, a medical doctor, who then is trained in radiology, so a specialist, a radiologist, and they interpret that imaging. So my role in that, I guess, in the cog in the wheel, is that I then supply that imaging and then send it on to radiologist. As a radiographer, you're often working in fast-paced environments, depending on if you're in that clinical environment, the private clinic, or even a public hospital. So sometimes you may be working in the emergency department, or sometimes you may be working in outpatient X-ray or CT. A month-to-month roster for me. Fortunately enough, I've been trained in both CT and MRI imaging during my time at the Alfred, and a month-to-month roster for me sees me probably working a week out of a month in maybe the trauma department, CT scanning very sick patients as they come through, and then maybe the next week I'll be in ICU mobiles on providing X-rays to the ICU round, and even going into that COVID pod in the ICU, and supplying chest X-rays for the morning round as well. So I've just finished training in MRI, so that basically means that I'm working in MRI as well, which is a really good career outlook. Basically, I chose to study at Monash due to the dynamic course structure that it had to offer. Basically, not only supplying the underpinnings of the degree, the job that you're going to do, so it does prepare you for the basics, but it also gives you the knowledge for the extensions of practice. So whether or not you want to come out as a radiographer and you want to say, oh, I want to do ultrasound, or I want to do angiography, or I want to do CT, I want to do my master's in CT or anything like that, the Monash course really prepares you. It gives you that information that allows you to pick and choose. You can then, after you finish your Monash degree, it gives you enough information about ultrasound and MRI, so that when you're in your workplace eventually, and you think back to your time at uni and you say, oh, I really did enjoy MRI, or I really did enjoy ultrasound. I believe that the Monash course, on top of the other ones, really does give you that emphasis and underpinning knowledge of those, so you can choose easily down the track. So not to mention that as you graduate, you'll probably most likely be proficient in your X-ray and your CT, and then you'll just get some on-the-job training for CT, remembering that MRI and then ultrasound is going to be more extensions and more study on top of that as well. Basically, during my time at Monash, I really enjoyed the rad labs and anatomy labs. I feel like Monash was really hands-on in that you could really get in there with the X-ray equipment, position your fellow classmates in different X-ray positions as well, and really practice of what it would be like in the clinical environment. Monash as well, radiography specifically, provide clinical placements twice a year, as well as an internship at your 4th year as well, which is really great and gives you that experience and foothold into the professional community. A highlight of my degree, personally for me, was that my 4th year research project, I created a project in biomechanics and worked closely with post-mortem computer tomography data sets at the Victorian Institute of Forensic Medicine. And this really gave me the insight into not only research in general, but research in my field of practice, and also gave me a good kind of foothold as well to take that research. And I presented it at multiple conferences throughout that year, and won multiple awards, which is really good for me. And it gave me that kind of knowledge that maybe someday I would like to come back and do maybe a PhD like Alex is doing, or something like that. And I think radiography gives you that kind of ability, and it's very dynamic in what you can do. You can swap and choose. I've also been the first semester of this year, I did some teaching within the Department of Medical Imaging as well for radiographic anatomy. So I feel like it's very dynamic, and you're not really pigeonholed into one spot as well. Just quickly, something I enjoy most about my role is definitely working alongside the healthcare professionals. So I work with doctors, nurses, physiotherapists, other radiographers, and really it's a patient-centered approach. So we work in conjunction with each other to provide that very fast-paced kind of imaging to patients in need. So for example, working in the trauma center at the Alfred Hospital is phenomenal, seeing everyone work around the patient, and the communication that exists between healthcare professionals to get the job done. And I feel like this has only been heightened during the COVID-19 pandemic, where I think everyone's really gotten together and worked towards a common goal to supply the imaging and supply the best needs for these patients.
Brilliant. What a great insight too. Thank you so much for sharing that. And I like that you started off with, hold on, let me describe the difference between the radiologist and the radiographer. So yeah, radiographers, which I know is a common question that comes up. I remember once someone told me, there's only one thing you need to remember the difference. Radiographer, photographer. All right. Do you got the difference? I can't tell you. It stuck in my head to this day. Thank you so much, everyone, for giving us a bit of an insight, introducing yourselves and taking us through your journey through Monash, and then now I guess a bit about where you are at the moment. So I want to throw this over now into our question and answer panel and dive a little bit deeper, I guess, to learn more about your fields. So I want to start by asking a question to the general panel, and I want you to think back to that sweet spot time of when you were finishing up your degree and thinking about moving into your careers. I know that can be a really scary time for a lot of students, and we think about that time even when we're in high school, don't we? Right? So what was the process, I guess, for you to get that first job as a graduate? How long did it take? And I know some of you already started to touch on that, but I guess just that process itself, maybe finishing your last exams or your last practicum, and then starting in the job. I want to focus on those of you who are currently in employment at the moment. Catherine, can I start with you?
Yeah, absolutely. Like I said before, I was actually really lucky in that my placement pretty much linked me into a job straight away. I finished my final exams in November. My placement supervisor told me about the job. I applied for it in December, and then I started working in January. So it really only took a couple of months to land my first job. I think the most important part is getting your key selection criteria right. And at Monash, we're really lucky to have this thing called Careers Connect, where they can really coach you and help you to nail your job application. And I'm going to plug the placement units again, but as part of that, like health promotion practicum subject, we got to write a job application and key selection criteria for one of our assignments. So you're getting feedback from professionals who are actually in the field and know what to look for, like when you're applying for a job. So that was super helpful. But yeah, I was I was super lucky. But for those of you who might need to get that foot in the door, Monash runs so many networking nights and careers nights. So just go to as many as you can and make those industry connections.
Oh, great advice. Yeah, and I'm glad that you mentioned the networking opportunities at Monash and also Careers Connect. I can't tell you how great it is having a dedicated service to support, getting your job, that type of thing. I've loved working with them over my time. Emily, what about you?
Yeah, so my process looked a little different. So I actually started applying for jobs in March last year, because that's when a lot of the government departments start their recruitment process for graduates. So even though I was still in my second last semester, the jobs don't actually start until the following year. So it does seem quite early, but that's just when they start their recruitment process. So I started roughly in March, April last year. And it was a very long process. I applied for a lot of programs, not only in government, but across, health services as well. And, it was often quite difficult and often disappointing. Like, I applied for a lot of jobs, but my advice would be, apply for everything that you can, because for me, I really do think that if I hadn't applied and interviewed for, a long list of jobs before I interviewed for my current job, then I wouldn't have had, several interviews of practice. I wouldn't have written several applications to practice. So every little application you write, every interview, every, connection that you make helps for the next one. So I actually, for the government departments, the recruitment processes are quite long. But so I actually, applied in, I think it was April for this job. And then I found out the day before my last exam that I actually got got into the program, which was really exciting. And it took a lot of pressure off for my last exam as well. I could just, focus on that and not worry about job applications. So yeah, it was, I learned a lot from the process because, you get feedback, always ask for feedback from interviews or applications, and it helps you for the next one. So yeah, that was my experience.
Brilliant. No, and I'm so glad that you touched on the fact that sometimes it is a laborious process, and practice, it's such a cliche, but practice does make perfect. And it does, say sometimes take, a little bit of time before you land that dream job, and that's okay. And that's normal. And there's going to be support out there to get you through that process. Now, I'm going to throw over to you, Hogan.
Yeah, absolutely. So I feel like finding a job as a radiographer, especially coming from the Monash course, I find it quite straightforward actually, because they give you that opportunity to give you that 6-month professional clinical placement in your final year. You either choose your first semester or your second semester. If you choose your first semester, you can really wow them, your potential employer. And so basically, when the jobs roll around in November or anything like that, then they can think back to when you were there for the 3 months or 6 months that you were there for the first half of the year, and they can remember, that person was really good, and you come in for your interview for your job for the next year. And they can really think back, and I think it really gives you that opportunity to give you time to then display what your work ethic's like and how you are as a potential radiographer to your potential employer. So I feel like the Monash degree and that clinical placement, specifically that 6-month rotation, really gives you a good foothold in the door of your prospective employer. And I feel like those who weren't successful in obtaining a job with that the placement in which they took, then had a really good reference in which they could then move to other places. So instead of a reference from a placement that you were at as a student or somewhere that wasn't clinical as a radiographer, you then have 6 months worth of reference that, you can pick and choose different radiographers, or you can choose the chief or the tutor to give you a reference to then step on to securing full-time employment. But basically the process to get an internship where you needed to apply to different clusters of hospitals. So I applied to the Alfred cluster. I also applied to Monash and the Austin and Royal Melbourne. I got several interviews all over town, went to the interviews, and then you just pretty much put an order of picking those placements in. You get an internship out of that. You match with a hospital with that cluster, and then you then go into that placement, that 6-month placement with that cluster. And then obviously, if you work hard and you really display those attributes of a Monash graduate, you can then secure a job quite easily in the next year. And the field of radiography is huge, and it's changing every day. The pandemic, COVID-19, has only changed it even more. And I feel like there's going to be no shortages of staff anytime soon, especially with radiographers. So I feel like career prospects looking quite good for radiography.
Nice. Yeah, thank you so much. Yeah, that's so helpful and really insightful to kind of get a sense of that process, and that there is a bit of a process involved, through the application, the interview rounds, the internship pathways, those types of things. So that's really good info to know. Now, Alex, we have a question from the audience from Sumaya. Hoping to get a bit of an understanding, I guess, into the breadth of career opportunities with psychology. And I guess I want to touch a little bit about, so you're in your postgraduate studies at the moment. So I was wondering if you could provide maybe a little bit of insight into like the career opportunities from that, but maybe also could you contrast that with some of those without the postgraduate qualifications? I don't know, maybe some of your friends that might have gone into different jobs from psychology, and what is it about psychology that maybe makes the difference in the job field?
Yes, cool. Thank you for the question. I will try to remind me if I don't hit on any of the points. But what I'm doing right now, and it is the clinical psychology kind of area. And so what that means is I'm going to become probably what you think of as like a therapist. So you see people, they have various like difficulties in their lives, often mental illness. Maybe the difference that I didn't expect when I was kind of at the stage that hopefully the audience is it ranges. So it's not just sitting back in private practice and probably working with the worried well, but it can go all the way to people with bipolar schizophrenia who are having some really hard difficulties. And I think that's the breadth. You can go as far as you want into the severity of cases, into acute hospitals, if that's what is exciting for you. For me, that's still a little bit intimidating, but there's still plenty of room for working in the clinic, working with people who, when you talk about things like anxiety and depression, they don't sound so, but they cause difficulties for so many people, and the difficulties are still so real. So I think, you can work with milder and then more serious, but that's where that can work. Then with what research looks like, so that can look in so many different directions. It can be working with humans and trying out, like, does this treatment work? It can be, what exactly makes you like in my research, what makes you make a bad decision? Like, why do you keep going back to drugs? And you might think that we just talk about that, but what we actually get people to do is they do computer tasks and then we run some fancy like maths on it and we get some results. Or you put them in the scanners and you get them to do those fancy tasks and you see what areas in the brain light up. That's a whole thing. If humans aren't your thing, you can just work on big data in research. And there are also like those animal opportunities. I would say that Monash is much more geared towards the human research than the animal from what I've seen. And then let's talk about if you don't go down the path. And I think just to sneakily go back to that last question, I know I definitely don't have a job, but if you've read the process to become a psychologist and then even a clinical psychologist or forensic psychologist, it is a long pathway and it requires many hurdles. And I think Monash is really good because it makes you get past that first hurdle of getting into honours. And then when you do a really good honours degree, which you can have at Monash, that is really big up to get into that postgrad. So that's a side plug. And then talking about what career opportunities can you do if you decide, like I guess I did with journalism, that, hey, that's not for me. This is all getting a bit too scary and real. Well, there's so many options. I think, looking at the skill set you develop, stats is a huge part. And I think big data and analyzing data and all those kind of things, everyone who's spoken today has talked about stats, but it's so important and it can get you into so many different roles. Then if you think I've done a research project, well, then you're a project manager. You've come up with an idea, you've recruited participants, you've managed those participants because they're not always easy. And then you've written up a result, and that's pretty much, you get a supervisor, but that's you've done that. You can sell that on. Then you have like more common ones, like actual job roles. You have like HR, so human resources. There's marketing, where you can take all the things you've learned from psychology. You have, I have a lot of people who've gone into teaching actually after. They've realized that they really like that human interaction. They still want to do the caring, but the mental illness bit isn't appealing to them, or it feels super competitive, and it can feel super competitive. And it's just, there's so many options where you can still do that helping aspect. There's the teaching, you can do a master's of social work, you can do a master's in another kind of helping area. So I think, the possibilities are quite endless.
Absolutely. No, I'm glad that you've touched on, getting a bit of that diversity, but also providing that little bit of insight. I know, which is a common question around, well, what differentiates the clinical psychologist or being a psychologist compared to some of the other career pathways. And I know this is, as cliche as this may sound, we have this one line in our marketing material, which is like, if it involves working with people, then like psychology can take you can anywhere, because anything involves people. But in a way, you could absolutely highlight those benefits of, and I think what I've also really enjoyed hearing from everybody here is that I think that a lot of our fields do intersect quite a lot. We work within multidisciplinary teams, we work alongside one another, and we learn from one another. And so I just want to, do that extra little plug there at the end, that you're going to find wherever your degree takes you, you're probably going to have intersections with people from other roles as well. So can you believe that we are already right at the end of the session. I didn't even get to throw all the other fun curly questions that we had prepared, but that's okay. So I just want to take the time to thank our alumni panelists for generously sharing their time with us, their experiences, your insights. Thanks to everybody who has tuned in live online in our new COVID world. And I guess, so letting you know, if you are interested in learning more about the degrees that you've heard here today, I want to encourage you to head over to the booths, have a chat with our staff, learn more, ask questions, add some flyers to your swag bag, get in there, enjoy the virtual experience as much as you can. We really hope that we get to see you on campus soon. We can't wait. Hope you pick Monash, and we look forward to working with you. So take my time. Goodbye and take care. And thanks again to